Hello, my name is Jason McKinney. I'm a student at University of Charleston's ADM program, and today I'm here to give you an educational video about diabetes mellitus. I'm going to try to answer 10 questions regarding diabetes. The first one is, what is diabetes mellitus and what is the difference on type 1 and type 2? Diabetes is a group of metabolic diseases characterized by hyperglycemia resulting from defects in insulin secretion, insulin action, or both. With type 1 diabetes, it affects approximately 5% of adults with the disease, and it's characterized by destruction of pancreatic beta cells. Type 2 diabetes affects approximately 95% of people with this disease. And the two main problems related to insulin in type 2 diabetes are insulin resistance and impaired insulin secretion. So basically, with your type 1 diabetics, they don't produce insulin, and with your type 2, they don't use the insulin properly or they don't produce enough of it. Two, what are risk factors that are associated with diabetes mellitus? With type 1 diabetes, some of the risk factors are family history of type 1 or type 2 diabetes in any first degree relative, and it's slightly greater risk for a child if the father has type 1 diabetes. Also, exposure to Epstein-Barr virus, mumps, rubella, or cytomegalovirus, and maternal age younger than 25 years at birth. Now with type 2, the risk factors are an age greater than 45 years, race and ethnicity, overweight or obese. If your body mass index is equal to or greater than 25 kilograms, you're at an increased risk for diabetes type 2. 3, what are clinical manifestations of diabetes mellitus, and how are the clinical manifestations from hypoglycemia and hyperglycemia differentiated? With clinical manifestations of diabetes, first you have the 3 Ps, which is polyuria, polydipsia, and polyphagia. You also have fatigue and weakness, sudden vision changes, tingling or numbness in your hands and feet, dry skin, skin lesions or wounds that are slow to heal, and also recurrent infections. Now with clinical manifestations for hyperglycemia, it's increased thirst, headaches, trouble concentrating, blurred vision, polyuria, fatigue, which is just weak, tired feeling, weight loss, and blood sugar more than 180. Now with hypoglycemia, the clinical manifestations include hunger, shakiness, anxiety, sweating, pale skin, fast or irregular heartbeat, sleepiness, and dizziness. And number 4, what is diagnostic criteria for diabetes mellitus, and at least 3 laboratory tests. A fasting plasma glucose or FPG level of greater than 126 or higher, or a 2-hour plasma glucose level of 200 or higher during a 75-gram oral glucose tolerance test. A random plasma glucose of 200 or higher in a patient with classic symptoms of hyperglycemia or a hyperglycemic crisis, and also a hemoglobin A1C or HbA1c level of 6.5 or higher. Or 5, what are at least 5 lifestyle modifications in managing diabetes mellitus? Modifications that you can make to your lifestyle to manage diabetes include diet, exercise, weight loss, consumption of alcohol in moderation, regularly monitor your glucose levels, and also adhere to your medication regimen. 6, what are 3 different oral medications that can be utilized in managing diabetes? 3 oral medications include glipizide, metformin, and repaglinide. Number 7, what are 2 different insulin medications that can be utilized in managing diabetes mellitus? 2 insulin medications include regular insulin and Lispro. 8 is, what are 5 aspects in foot care management with diabetes mellitus? With your foot care management, you need to make sure you inspect your feet daily. Be gentle when you're bathing your feet. Don't use anything harsh to scrub them. Also, moisturize your feet, but not between your toes. Cut your nails carefully. You cut them straight across and you file down the edges, making sure that you don't cut them too short. And you also wear clean, dry socks. and you change them regularly, at least once a day. Number 9 is what type of diet would be recommended with a diabetes mellitus patient. Now, if you have diabetes, you should focus on eating lean proteins, high fiber, less processed carbs, fruits, vegetables, low-fat dairy, and healthy vegetable-based fats such as avocados, nuts, canola oil, or olive oil. And 10, what are 4 complications that are associated with diabetes mellitus? 4 complications include cardiovascular disease, nerve damage or neuropathy, kidney damage or nephropathy, and eye damage or retinopathy. Well, I hope that this video has helped answer a few questions that someone may have had about diabetes, and I appreciate your time.